Well, February is Black History Month, and we are literally in February this weekend. Well, our next guests do great work here in our community to ensure health equity for the Black community. Well, it is such a pleasure to welcome Kevin Patterson, Chief Executive Officer of Connect for Health Colorado, and Dr. Terry Richardson. She's the co-founder of Colorado Black Health Collaborative. Hello to the both of you. It's good to see you.
Good to see you.
Good seeing you, too.
Dr. Richardson, yes, welcome back to the Cocoa Couch. We love highlighting what you guys do because this is truly important work. So I'll start with you, Dr. Richardson. Tell us more about the Colorado Black Health Collaborative and how this is so great for people.
Yes, and it's hard to believe that we're in our 16th year of operation.
16.
Yes.
That's great.
But it started out just as a one-time event to share health disparities data, and the community said, we want to continue this. And we said, if you work with us, we'll continue. We knew that we were at the top or the bottom of all the health disparities lists. And so we thought it was very important to do what the community wanted us to do.
Absolutely.
So we were formed by the people, for the people.
That's incredible. And when you see numbers like that, ratios where you see the need is obviously there. Does that inspire you? Was that kind of like what made you want to start this?
Yes, and really because the community wanted this to happen, and we thought it was so important. So we worked with them to form our mission, which was to achieve health equity in Colorado's Black community. We know it's a daunting task, but we were just chipping away at it with a number of programs, including this resource directory.
And let's talk about that directory because this is something that people really need to be taking advantage of. And you brought a copy of it here this morning. Tell me all about this and why this is a good resource.
Yes, and one of the things the community shared is that they wanted a book that had a listing of Black healthcare providers, people with that lived experience, people that they could connect with. And we thought, wow, that would be great, but this sounds like a lot of work. Yeah. But we really wanted to honor what they said their need was. And so we, in 2010, published the first resource directory.
That's great.
Yes.
And it really is helpful for people when you have it all right there at your fingertips. Now, Kevin, what unique challenges do Black patients face in finding culturally competent care? That's actually a bit of a struggle. And how does the directory contribute to improving how they search for those?
Yeah, what we do at Connect for Health is really try to connect the carriers that provide the health insurance to the patients that are out there looking for their care. And a lot of times when they come to Connect for Health, they're asking us, where's my doctor? What network are they in? What are my prescriptions?
Sure.
You know, they're making very important decisions based on that. And so when we were kind of asked to figure out a way to help our partners here at the Black Health Collaborative on what to do with that, I said, well, this is, if our customers are asking for it, this is exactly what we should be doing. And every time I've been somewhere, and it was actually when I was at a meeting with Dr. Terry here, people were talking about the mental health benefits and trying to find someone that understands your lived experience, that understands your culture. It's extremely important. It really in those kinds of relationships.
It really is, and I completely understand that as well. Now, why was it important, however, for Connect for Health Colorado, which is, by the way, the state's healthcare insurance marketplace, to support the creation of the Black Health Resource Directory?
I think Dr. Terry said it extremely well. You know, this is what our customers were asking for. And so if there's a resource out there that we knew needed to be updated, we said, well, if there's something we can do to help, we at the exchange felt like it was just a natural progression for us to provide a resource for our common customer.
Exactly. And if that's what they're asking for, then that's where the focus needs to be, right? And Dr. Terry, what type of info, resources can users expect to find in the directory? Now, I saw on the website that this is like the 5th edition, so I would assume that it keeps getting better and better.
Yes, and that's our goal, to make it better and better each time. We've added additional providers. We have the traditional doctors, dentists, etc., but we also have doulas. We have advanced practice providers. These are new sections, but we also have social determinants such as nutrition, physical fitness and dancing. I always say I like to dance. So,
Yes.
you know, dancing is part of being healthy as well.
It really is.
So it's really expansive. I think we have 14 more pages to this edition. We have over 100 doctors and mental health providers. Mental health was really a focus. We last produced the directory during COVID, right before COVID hit. And so we hadn't done it in about 4 years. So we knew that mental health was very, very important. So we really did a lot of work trying to get more congruent providers in the mental health realm.
That's great. And really quick, where can somebody get one of these?
They can reach out to Colorado Black Health Collaborative. We are distributing the directory throughout the community to some of our priority populations like the seniors, those that can't get to our office. It's also electronic. It's online this time.
It's online,
Yeah.
okay. And we're going to give you guys all that information in just a second. But before I let you guys go, Kevin, what has the response been to the Black Health Directory? What has the community said about this?
I have been so overwhelmed by the response. I knew it was important, but for there's so many reasons that it's important. For a lot of the reasons that Dr. Terry talked about is just how expansive now the network is. And, you know, we could get it out in hard form to folks we knew in our circle. But now with this digital version that I was really pushing for, it really gets to places we did not even know about because people are just spreading it on social media. And so we're able to just expand our reach exponentially.
Absolutely, and a lot of people nowadays, that's kind of how we get the information, right? We go online and then you can share it, and then it's a chain. It goes on and on and on. Well, thank you both for being with us this morning, and of course for the work that you do every single day. This is a wonderful resource, so thank you.
Thank you for having us.
Yeah, thank you for the opportunity.
Absolutely, Dr. Terry. And you can learn more about the Colorado Black Health Collaborative and the Black Health Resource Directory by heading to the website. It's coloradoblackhealth.org